Vad roligt att just du har valt att lyssna på vår podd. Tillsammans kan vi skapa större möjligheter för förståelsen för integrativ medicin och hälsa. Är du intresserad av det så bli gärna medlem i vår förening och en del av vårt nätverk. Mer information om det här kommer i slutet av avsnittet, men du kan också redan nu hitta det på vår webbsida integrativ-medicin.se. Jag som leder samtalen heter Lena Källqvist. Jag är ordförande för föreningen som driver den här podden. Min yrkestitel är legitimerad psykoterapeut med grundutbildning legitimerad sjuksköterska. Today we are recording remotely from Mallorca, where our guest Patricia Ramirez Berglund is located. And next to me is my excellent sound engineer Rasmus Tibell. A warm welcome to you, Patricia.
Thank you. I'm so happy to be here with you.
And I'm so happy that you are here with me and have this episode. We have planned this for so many years now, actually, right?
We have. But, you know, it always feels like all the causes and conditions have to be right for it to happen. And now they are.
Yeah. Patricia, before we start with the question that I want to start with, I just want to let the audience know that you are a doctor of Chinese medicine and an herbalist specialist. Can you say so?
Absolutely.
And a functional nutritionist. Right.
That's right.
So I wanted to say that just to put a frame of this episode and this conversation, because that is what we're going to talk about. But before, I want to ask you in the beginning who you are. Who are you, Patricia?
Yeah.
Who are you? And how did you come to be so deeply interested in what we call alternative medicine? How did everything begin?
Well, that's a very, very long story, but I'll try to make it as concise as possible. And I'll also say, this is a side note, I actually don't use the term alternative medicine. I always use the term complementary medicine. And I think that's really important. And I'll say why, and then I'll go back to who am
Please
I?
do, because that's important.
Yeah, because with the type of medicines that I practice and I use in the clinic, I think the reason why these medicines, like Chinese medicine, functional medicine, and these like Ayurvedic medicine, the reason they work so well is because they don't have a reductionist view of the body, of anything really. So there's such a root cause, you know, sort of looking for the root cause, looking at the entire system. And this is why I feel the same way with the different medicines and how they work together. Western medicine, Chinese medicine, functional medicine. The idea is that these can all work together in order to really support and better patient outcomes. So the idea is that we're keeping the integrity of each medicine and using each one and not dissolving it in any way, keeping the integrity of each one, but really bringing in the tools when we need them. So that's why I like complementary medicine, because I often use functional medicine, you know, and as you know now, I'm starting to use hypnotherapy in the clinic. So, you know, using that and using all the medicines together. So therefore complementary instead of alternative, which makes
very
you think
good.
more.
Thank you for sorting that out for us, because that is very important. And now we're going to talk about things that the school medicine, or what we will call it, wants to call it alternative medicine, because it's not so much they say it's not so much scientific evidence for it, and so, but actually it is, and we're going to come into that. So when you have some scientific evidence for whatever called alternative medicine, you can call it complementary medicine. And actually in Sweden, when we had this KAM-utredning that Professor Kjell Asplund made, they tried to sort that out as well. And when we tried to dig into that because we had an remiss answer to them. It was that everything that is not included to what the paradigm wants to have as the or should we call it the etablissemanget wants to have for the things that you have if you go to the ordinary medicine or healthcare, everything outside that is called alternative medicine, even though it could be very much scientific evidence, very much studies made for it, but the etablissemanget have chosen certain things, certain methods, certain strategies, certain, whatever, to be inside or instead of outside the regular system. And when it's outside, it calls alternative. So with that, we know that alternative medicine can also have a lot of scientific evidence in the bottom, but we haven't chosen it for certain circumstances.
Yeah. I completely agree with you. And I think it's also an important point that there is a lot of peer-reviewed, sort of articles and clinical trials that show the benefits and how Chinese medicine is effective using herbal medicine, using acupuncture and the different modalities. We also must remember that the trials as we run them now do have their limitations. And there is a lot of research where scientists, doctors are trying to prove a theory where they already know the answer and are trying to prove the answer that they want to prove, if you see what I mean.
Yeah.
So I think that Western medicine also, as it evolves, we should have new standards and new way of proving things in the clinic, because there are limitations in that. And I think that's a big other discussion that perhaps we can have on a later date, because you can't necessarily hold herbal medicine, for example, to a double-blind clinical trial the way it's run now for a lot of different reasons. But that's something to also think about, that we also have to, those are standards that we can't hold everything to. Because in the end, doctors are scientists. We should be scientists, and we should be learning and discovering new things all the time, instead of constantly trying to work in the same sort of bubble and reproving the things that we already know, right? This is science. And also science is learning from each other. And this is where I'm so shocked sometimes, well, not so much where I come from in New York, because in New York, there is a curiosity with Western medicine and complementary medicine practitioners. I've had surgeons ask me, what herbs do I use after surgery? What can I do for my patient? What can I, this kind of like curiosity, which is how a scientist, a doctor should sort of see the world. So
right.
yeah.
And scientific, if you go into a study, or you have a hypothesis, or a question or an idea or something, you should go in with it and try to kill your darlings too. That is scientific. You should not do the other way, as you now explain to us how it, and that we know that many try to prove what they want to prove, and that is not scientific right to do.
Absolutely.
No. Okay, so you just mentioned that you are from New York. You mentioned about the latest education as a hypnotherapist. We come into that. So to just have that as a frame, you must tell us, who are you? Where do you come from? You come from New York, but tell us everything, and how you come into Chinese medicine. Sorry.
Yeah. So I'm originally from New York. I was born and raised in New York. I'm a first generation baby. My mother's from the Dominican Republic in the Caribbean, and my father's from Colombia in South America. So I'm a first generation New Yorker, which is quite typical where I come from. And so I grew up speaking Spanish at home, and a lot of this sort of mixed cultures. And I was very, very curious and artistic as a child. I was always drawing, painting, and wondering about things and people and emotions and how things work and why things are so, and what's this magic. That was always my thing as I was a child. What's the sort of the magic in the world, and can I see fairies, and can I talk to energies that I can't see physically, and all of this. And my mother is also a bit like that. So it was something that we talked about a lot at home and supported. And so I was very good at art. So after high school, I thought I would go into art because I was very good at it, and it was sort of like the expected place for me. And so I went to Parsons School of Design, and I graduated with a design degree, and then I got hired to work as the creative director at a television station in Malaysia. And it was the first free-to-air television station, NTV Tujuh. So I worked there for a couple of years, and that was amazing. I traveled throughout Asia, and that's where I discovered Buddhism. I was always interested in Buddhist practice, and coming from New York, where, we were sort of exposed to a lot at a very early age. I always loved museums. I knew a little bit about Buddhism and the teachings of the Buddha, but that's where I became sort of really interested in what is Buddhism and this way of life and this way of seeing the world and thinking. And I came back to New York, and after a couple of years, and I worked at a couple of design studios, and they were very successful. And I started to feel very disgruntled very early in my 20s, feeling like this can't be it. This can't be it. It can't be just to, live in this, what I felt was a very superficial world of, like the people, for example, I had a client that would come in and say, I want to use this stock image. And this was a long time ago. This was in the 90s. So we would buy the image for 4,000 euros. And then that afternoon I would get a call, I don't like the image anymore. And I felt like I don't feel like I can work in this industry. And then at the same time, I was going to a Chan Buddhist, was a Chinese Buddhist temple. And I was a very serious practitioner, and I started to volunteer. And eventually I would go off and live with the nuns for a couple of months, and then I would come back and work, and then I would live with the nuns. And I started to feel like maybe this makes sense to me. Maybe this is my path. And I had a period
to be a
of
nun
time
in a
to
Buddhist,
be a Buddhist nun.
Mm.
So because I felt like I had never in my life really felt so like this is the path for me. This is where I feel best, healthiest. Everything it made sense to me. And so I would go off on these long retreats, silent illumination retreats, where there was no talking, and it was a lot of meditating throughout the day, and then work practice, and just have days immersed in mindfulness. And after one of these retreats, it occurred to me, and I'll tell you, I think there's a lot going on as far as how we process things that we don't even have consciously, more subconsciously. But I had this thought after a deep meditation, I'm going to go back to New York, and I'm going to practice. I'm going to learn Chinese medicine. I'm going to be a Chinese medicine practitioner. It wasn't something that I was thinking about. It was something that just occurred. And again, it's because I think there was an internal process that I wasn't even aware was happening. So my retreat facility was upstate, 2 hours north of New York. So I went back to New York City. I found a college with a program that I thought had a lot of integrity. It was a sister program to a program in Beijing, in China. So I went and I immersed myself completely in that for 5 years. And I got my master's in traditional Oriental medicine. And I loved every second of it. I never looked back. I never felt like, what am I doing? I absolutely loved it. And then I met my husband, who's Swedish, in New York. And we had our first baby. So we moved back to Stockholm because we were thinking, where should we live with a family? And I opened up a small clinic in Stockholm, and I worked there for a couple of years. And then we had our second baby, and we ended up moving back to the States. And I lived in Massachusetts for a couple of years, and worked at a very, very busy clinic there, which was fantastic because I saw such a very diversified population of patients and dealt with a lot of different pathologies. And that was wonderful. Then we moved back to Stockholm. And I started to feel like, ooh, I want to sort of really start diving deep back into my studies. And that's when I thought I want to do now my doctorate in Chinese medicine. So I went back to school for another couple of years, and I did a doctorate in Oriental medicine with a concentration in integrative medicine. So how the Chinese medicine model fits in the Western medicine model. So I did that, and I graduated, and then I went back to a small private clinic, and we worked together for a little while. Yeah, and then another practitioner of Chinese medicine, Diamantis, called me. We had met, and he said, "Oh, I really, really want to have you at the clinic. I don't know anybody that knows herbalism the way you do. I have a fully stocked, raw herbal pharmacy. Please, please, please come and work with me." And I thought, and then I decided I'm going to give it a try. And I did that for almost 4 years, and that was fantastic because I got to write a lot of herbal formulas. And that really is, herbal medicine is still probably my biggest sort of passion within the Chinese medicine model. I love herbalism so much because of its great potential. And I have to say that, I also have studied, I did a couple of years with, there's a practitioner called Mazen Al-Kafaji, who's a bit of a superstar in the herbalist world globally. He was based in London. He's written textbooks. He's quite incredible. And with him, I learned specifically how to use Chinese herbs, Chinese formulas in dermatology through the perspective of dermatology, the scope of dermatology. And this is really, one of the reasons why I love herbalism so much is because Chinese herbalism, Western herbalism as well, but specifically Chinese herbalism, is able to resolve issues where Western medicine is still falling short. And these areas for me are dermatology and women's health concerns. And I'll say dermatology because I have had so many patients with severe presentations of psoriasis, eczema, amongst others, where as far as Western medicine is concerned, we have steroids, we have antibiotics. That's essentially it. There are some other things, but those are the two big ones. And they're kind of putting a Band-Aid on the problem. In Chinese medicine, we say that, steroids are sort of pushing the pathology deeper into the system. But once you go off the steroids, once you go off the antibiotics, many times the problem explodes and you get what's called a rebound effect.
Right.
And with Chinese herbs, I have been able to, it's not me actually, but my patients have been able to completely heal, if not at least 95% resolve their issues. And the same with women.
Amazing. That is
it's
amazing.
So amazing. It's so amazing. So this is where I specialize, and this is really my passion, is dermatology and women's health concerns. Women's health concerns, again, when we're talking about hormone regulation, fertility concerns, menopause, which by the way is not a pathology, but there are some symptoms that can come up with menopause when we're not balanced. Menopause is absolutely natural and to be expected if you're so blessed that you get to live into your menopausal years.
Right.
It's a blessing. But Western medicine doesn't really have an understanding of how we can regulate hormones outside of like the pill and, of course, hormone replacement therapy and these kinds of things. So again, this is where herbalism really shines.
Because I know that you have had this all along, your special interest in women health, right? Because
Absolutely.
when we worked for a couple of years, as you said, I know that this is your specialty, and you just, kind of always have deepened your knowledge more and more and more about women health, doing everything that you can so much about.
So much so that a couple of years ago, I founded with another colleague of mine who's a nurse and also an acupuncturist. Her name is Josephine Hemningsson.
And we have her also in the pod. So she has her own episode in the podcast. A couple of years ago, actually, when she just have become a nurse.
Exactly.
Yeah, wonderful, Josephine. She's amazing.
So she is. And so we founded Urchikit because we saw such a need in this area of women's health concerns, especially when it comes to, like I said, like hormones and fertility. And her being a nurse, she really has a foot in both worlds, which is fantastic. So we started this company because we felt like this is such a way that we can really spread and propagate herbalism throughout the Nordic region, where it's really lacking. And we're the first Chinese medicine inspired tincture company in the Nordic region. There are some other sort of Western herbs, but I think our tinctures are really important because they're designed by a doctor of Chinese medicine and not just someone who likes to play with earth, which is absolutely fine and wonderful and great. But these are really designed formulas that have a medicinal value and integrity. And they're also the cleanest herbs. They're completely organic, sometimes biodynamic. They're third-party tested. And they're designed by me, and they are formulated and made in England with a tincture company that has been making tinctures for 100 years. And they're licensed by the medical system in England. So they have like all their third-party testing. They test for contaminants and heavy metals and all of that. So that is really, this was like my passion to how I can bring this passion to not only my patients, but to as many people as possible. So the other sort of like drive for Urchikit is that I saw that in Sweden, there's so many practitioners, acupuncturists, which are wonderful, but don't use herbalism. And I don't think you necessarily need to use herbalism, but I think it really does benefit your patient outcomes. And I think that every acupuncturist needs to understand, at least, they don't have to do, the years and years of training that I've done, but they need to be able to at least understand how the herbs work. And so Josephine and I are now helping acupuncturists throughout Sweden to understand how they can use the tinctures to work with their patients so that they can really deepen the outcomes in the clinic. And we have several acupuncturists now, and actually massage therapists and a couple of midwives that use our tinctures in the clinic. And they've told us, oh my gosh, this is fantastic, because I feel like my patients go home and they're still able to sort of continue the treatment while they're at home by using the tinctures. So we offer, if there's an acupuncturist that's feeling a little, I want to understand, how do I use this better? I see a blood deficiency. How can I use tinctures for blood deficiency? Then we can do a one-on-one call where they get like a workshop from me, which is very nice, of how, okay, I see Qi deficiency. What do I do? What herbs do I go to? What tinctures?
And in Sweden, there's it's very strictly holden for everyone that is licensed in anything in healthcare system. So I think it's that's why it also is kind of problematic for those to use this. use this knowledge. So maybe they do it for, they can say to their clients, their patients, that this can be kind of self-care treatment at home, just to take care of yourself. And that is very good. And if you just look upon it like a psychotherapist, is to calm your nervous system, you take care of something, you do something by yourself. You don't have to go to anyone, put your power in someone else's knee. You can do things for yourself, which is good and very good for those who are going to have a baby and just start to take care of themselves and take care of the baby in the long run. So maybe they use that in that way, or what do you think?
Absolutely. And I think as a complementary medicine practitioner, most of the work that I'm doing in the clinic is actually teaching people how to take care of themselves, or just sort of passing on this knowledge so that they can do the healing themselves. Because I am really of the belief that the body can heal from anything. And I really say that with all the confidence and all the love in the world, because I have seen it. I have seen it with my own eyes. The body can heal from anything. And I tell my patients that. So I don't want them to think that they come to me and I, do something to heal them. No. I'm just using my knowledge and my wisdom of years of practice to share with them this food, this lifestyle modification, these herbs, these things, meditation, or as you said, nervous system regulation, all of this. Take this now and go off, because your body can do all the work. So I think that's really important for people to really, they must know this. Your body can heal from anything, no matter what anybody says or what anybody has told them.
They must know that they have so much power over themselves, and they can use our when we today we're recording this, it's in January, and maybe we will publish this episode later on into the spring, and I think that we have published episode with Peter Wilhelmsson, and he's a natural doctor in Sweden, and he wants to say that the patient should use us, everyone that is in this system, as a consult to whatever they need to heal themselves. Be very cautious which kind of therapist they should ask, and they should see us as consulter for their health, to bring the health back to them. And that's what you are saying now as well, that you try to teach the patients how to take care of themselves so they can start a healing process for whatever they are. They want to heal from.
That's exactly right. Yeah. And I think, with all the tools that I use, which, as I said, herbalism is sort of the first, my first go-to, because I'm quite good at it and I love it so much, and its potential is absolutely incredible. But now with this new model that I'm starting to bring into the clinic, which is clinical hypnotherapy.
Yeah, tell us about that, because now, this week, when we are recording this, you are going to put up your thesis about this master. Are you doing a master in?
Yes.
Tell me.
So
yeah.
So now, I've been. This has been very intense this last year, because I dove into this education, which is fantastic, phenomenal, and I'm so happy I did it. But it's also, I have 3 kids and
a husband.
And a husband, and a couple of dogs, and a lot going on. But
and a practice in Mallorca, in Palma, and you have retreats and so on. So we will come into that. But you have a lot. So and you have also studied this and done this master.
Yeah, okay. But I always, for me, it's really important, and this is just sort of my nature. But when I study something, I like to really go into sort of really geek out on it. And so I thought, well, I can take a course in hypnotherapy. And then I thought, no, I want to do like the most complete sort of education I can possibly do. And I'm doing it now with the University of Valencia in peninsular Spain. But it's a master's in clinical hypnotherapy and psychosomatic work. And that's really about understanding what we call psyche shocks, I don't want to use the word trauma because I think trauma now is a very loaded word and everyone talks about trauma, 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 trauma. And of course, anything can be a trauma, but psyche shock has a more sort of specific definition of what is a psyche shock and what can sort of qualify something as a psyche shock as opposed to like a trauma. And how these psyche shocks have affected us physically. So it's an emotional or it's a circumstance that has happened that has caused some kind of overwhelm in our system that has now changed how our system physically, emotionally, mentally works. And usually it's changed or sort of created an imbalance, let's say. So understanding, finding where what was the shock, the psyche shock, what happened, explaining to the patient what happened when they experienced this and how it affected them physically. And sometimes it's very obvious because, people can have an autoimmune condition that all of a sudden comes on, or type 2 diabetes or a cancer or anything like this. And they can often say, oh, it's in my family or it's this kind of thing. But actually, I really believe that there is always some kind of emotional or some kind of the part of the root cause always has an emotional component to it. Because I really believe in epigenetics, and epigenetics being that.
Could you please stop it there and just say something about epigenetics for the person that don't know what that is?
Yeah. So epigenetics is the understanding of how our environment and circumstances, so environment, it could be sort of our literal environment, where we're born, the air that we're breathing, the food that we're eating, the people that we're around, the emotions that we're experiencing, how all of that plays into our genetics and the expression or not expression of certain proteins. So you and I can have exactly, of course we don't, but we can have exactly the same genetic material. And one of us might get a breast cancer and the other one not. Why? And if you have two, like identical twins that were raised exactly in the same way and experience exactly the same everything, one might get sick and the other one not. Why? And this is because now Western medicine recognizes epigenetics and also recognizes, well, maybe that's too long of a conversation or a tangent to go off now, but how we can actually inherit, traumas and how that affects our epigenetics. So if I'm the grandchild of someone who was in the Holocaust, how that can, because of epigenetics, how that can have certain proteins express or not express.
Right.
So epigenetics is really what we talk about in complementary medicine, isn't it? Because in complementary medicine is how everything is affected by the whole. There is no reductionist view or vacuum sort of understanding of, just the cardiovascular system. No, it's an entire system, not only this system, but our emotions, our environment, the seasons, all of this, and how it affects our health.
Right. So, thank you.
Yeah.
Very good explained. Very good explained. So, please continue.
So the idea with this new tool that I've learned and I'm starting to implement in the clinic is, how do we take an experience that has caused some kind of overwhelm in us because we didn't have the coping skills or mechanism within us to deal with it? It's caused an overwhelm. How do we find that imprint, which is in the subconscious, the unconscious? How do we bring it into the conscious so that we can heal it and deal with it and then heal if it's presenting physically, then heal the physical.
Right.
I just think it's a really fascinating science, and it is a science, and there's a lot of clinical research that supports clinical hypnotherapy. My professor specializes in oncology. She works at the hospital in Valencia. She works solely with patients that have some kind of cancer diagnosis.
Right.
So she supports them with any other therapies that they want to and are receiving, chemo or radiation. She supports that, and she has really seen the most incredible outcomes of patients understanding their cancer, where it comes from, and healing themselves, because the body can heal. I mean, we see this with immunotherapy, right?
Yeah.
The body's able to heal from anything, even from what is called a terminal stage 4 cancer. The body can heal. So it really is completely fascinating, and it has absolute overlap with Chinese medicine and how I work in the clinic anyway. But now this is the tool of helping my patients understand the connection, because, and we say this in Chinese medicine, just from understanding and having this realization of, oh my gosh, this breast cancer might be connected to an attachment issue that I had with my partner 3 years ago. Just having that, bringing that from the subconscious to the conscious is already a healing in itself. There's already a shift that happens where the body recognizes it and says, I'm able to take care of this. Now I understand where this is coming from, instead of, being in this place of fear and shock and overwhelm.
Right. And go into to be self-powered, to be able to, I understand something that I actually can do something about. And maybe it also make me curious about myself. What is this? Why do I have this stress that actually is not very good for the immune system? So if I want to come back to heal something within me, I have to have a calm nervous system. So the understanding, the knowledge, makes us more possible to heal the sickness within us, right?
That's exactly right.
So to just take that from the beginning, you went after to have been a nun. For how many years were you a nun?
No, I never became a full-fledged nun. So what I did was I would go and I would live with the nuns at the monastery,
and it was
practice.
kind of some month now and then. Yeah. Okay.
Yeah. So that was I did that for maybe 10 years of my life.
So it's a very long time, and a very, you have dove into it very, very much.
Very much,
you would say.
Yeah.
So after that, you had this realization to become a doctor of Chinese medicine. So for the one who has never heard about the Chinese medicine, could you please tell us about what is Chinese medicine?
So, well, traditional Chinese medicine has a very, very long history. It's what I would call sort of a medicine that's based on case studies, meaning thousands of years of understanding what herbs relate to what organ systems, and what happens when you take this herb and combine it with that herb, and acupuncture the same. What happens when we put a needle in this specific place? And so Chinese medicine has a very, very long history, at least 3,000 years. Some people say more like 5,000 years. And we have the understanding that there is no disconnect, that everything is connected in the body, as well as, internal as well as external. And by the understanding of how energy flows, and we use the word qi a lot in Chinese medicine, but qi,
and that is kind of,
qi is life, really. And, it's energy, and we have the understanding that qi can sort of flow in these different canals in the body. But qi can be the immune system. We call it wei qi. Da qi is like the air that we breathe. which of course is part of life. Without that, we cannot live. Guqi is food, how we break down certain foods in order to create nutrition, in order for us to live. So we use a word, there's so many different types of qi. So Chinese medicine is really the understanding of these different points in the body that have different abilities that are deeper or more superficial in the body. And by sort of using them, we can get very specific sort of outcomes, and we can cause specific physiological expressions in the body. I think, people often ask me, what is Chinese medicine? And I think the best way to sort of explain how Chinese medicine sees the body is that in Chinese medicine, we talk about, as I said, there's no disconnect between the emotions and the physical body. And the word Xin, which is the heart and the mind, is the same. There's not a separation between the heart and the mind. And I think that's such a poignant and such a perfect way to explain Chinese medicine, that there is no sort of mind. The mind is the heart. It's the same. Yeah. And that's, I think
so beautiful.
It's really beautiful.
So beautiful.
Yeah.
And it goes back to also to think about the polyvagal theory, where you have the heart brain connection, which is a much more later knowledge than the 5,000 years knowledge about Chinese medicine. Yes. And suddenly the brand Gucci so new inform about why I want to have more Gucci things. No, sorry.
That's
but
okay.
Gucci. It was Gucci.
Yeah,
Gucci. You said that. Gucci.
Make that connection. Yeah. Gucci.
I made that connection. You didn't do that. I did that. Yeah. That's more about me than you. So you're good.
So Gucci. So Chinese medicine is really about figuring out where the imbalance is in the body and how to regain that balance so that the body can heal itself. Because Chinese medicine understands that the body can do all the work. We're meant to age. We're meant to be born and die. No one escapes that, and that's normal, and that's not a pathology. But we're also meant to age well and age healthily. So the idea is we look at the tongue, we feel the pulse, we feel the abdomen, we feel the different channels, and we feel what's going on here. Is there a deficiency? What's the color of the tongue? Is there a coat? Does the tongue look a little bit purple? Does it look red? And that tells you or tells us exactly what's going on in the system, especially with the center, the digestion, which is, of course, the middle of our immune system. It's like the beginning and the end of everything is our gut. And I think Western medicine is also understanding that now more and more. Yeah. The gut and the gut-brain axis and all of that. So Chinese medicine is really about figuring out where the imbalances are and then trying to bring the body back to balance with needles and herbs and cupping and warming therapy and lifestyle practices like mindfulness or grounding, and of course food. There is no separation between herbs and food. In Chinese medicine, we say herbs are food and food is medicine. It might be the other way around.
No, it sounds logical.
But yeah, so there is no separation. We don't see the separation between food and herbs. They're considered the same. So so that's in a nutshell what Chinese medicine is.
That was well explained for everyone that wants to know about Chinese medicine. So, but just after that, if you just want to tell us, if you would like the audience, the listeners, to know, to take with them some quote about Chinese medicine, how they can bring it back into them or to their lives or to someone that is ill now, to just say something. What would you like to just kind of put out in the to
Well,
them?
there's so many quotes in Chinese medicine, but what comes to mind is there's a midwife that I love. Her name is Aviva Ram. She was an herbalist first, and she became a midwife, and then she, in her late 30s, decided, or mid 30s, decided that she wanted to become a Western medicine doctor, so that she could bring all of her wisdom into more of a Western medicine model. She's from the US. She's also a New Yorker. Her name is Aviva Ram, and she went back to school. She went to that little medical school called Yale. And so
That one,
that little one.
we might have heard of it sometimes.
Exactly. And so she became a full-fledged Western medicine doctor. And she has a quote that says, and I love this quote, and I put it on my health plans. When I write health plans, I give it to all of my patients, that says, "No one has ever allowed you to believe that your body can heal from anything, but it can." And I'll say it again. No one has ever allowed you to believe that your body can heal from anything, but it can. And it's not a Chinese medicine quote. It's a quote from Aviva Ram, but it's absolutely the scope that we have in Chinese medicine and in clinical hypnotherapy and in functional medicine and in herbalism and all of the medicines that I practice.
Right. Kind of a knowledge to live more, what you say, what would you call it? With all this knowledge, you can live more
connected, more in tune, more awake. Yeah, because it really is sort of an awakening. When you understand, when I go and I eat this thing and I don't feel well and I just push it away and I don't pay attention, and then I go and I eat this other thing and I feel so clear. It's an awakening of sorts of how we connect to everything else, to our food, to our environment. It's like I tell my patients, if you're hanging out with somebody and you don't feel well after, if you feel exhausted after, you must
don't
make
be
this.
there.
You must make this connection, and you must then say, I shouldn't right now. I can't be with that person because I don't feel well. So it really is making a lot of realizations and connections with ourselves. Going sort of,
So, Patricia, this is the first episode of many coming on, and before we stops, is there anything that we haven't been talked about that you want to say something about before we stop this episode?
Yeah, well, I mean, there's so many things I want to say about. There's so much I want to say about herbs, and there's so much I want to say about hypnotherapy, but I think the one thing I always want to leave my patients with is this. And I say this because when I should also say I work with patients in Mallorca, but I also work with telemedicine. So I still work with a lot of Swedish patients. But telemedicine is that I can have an appointment with a patient as we are talking now on video, online, and I can do a complete intake with them by asking my questions, by looking at their tongue and looking all the sort of signs and symptoms. And then according to that, I can write an herbal prescription. That's if they need an herbal prescription. I usually, what I do is I write a very detailed health plan. And that looks like, okay, so according to Chinese medicine, what food should you be eating or not eating? What lifestyle practices should you include in your daily sort of routine? Because I also practice functional nutrition, I work with vitamins and minerals and those kinds of things. So I also do a very detailed to take perhaps this combination for this amount of time. And whatever else. But I usually write a quite extensive health plan, and my patients feel sometimes like, wow, this is a lot. And I always tell them a little goes a long way. And it's so much more important to do one small shift than to change everything one small change that you can stick to for a certain amount of time will have so much a more profound difference than changing everything all at once. And something as simple as, the morning routine for my patients, for example, I tell them before getting your cortisol like all pumping, take 10 minutes to wake up, have a warm glass of water with a little bit of lemon, have some clean sea salt. And that's another conversation we can have another day. What is clean sea salt? And that's really important. Under your tongue, drink your water, be with yourself, look into the sky. It doesn't matter if the sun's not there. Just look into the sky, be with yourself for 5 minutes and do this practice before getting the kids and making breakfast, starting your day and your phone calls and all of this. That little thing can have such a profound difference on your nervous system, your immune system, your well-being, your organs, your liver, because now you're starting the day with this like hydration instead of your cup of coffee. So I'll leave you with that a little can go a very long way with consistency.
Dr. Patricia Ramirez Berglund, thank you so much to share your knowledge and to guest us in this podcast. And I'm looking so much forward to our next episode.
As am I. Thank you so much, Lena, for having me. And thank you for taking it in English. It's not easy. One day I'll be able to take it in Swedish.
No, this is very good. It's you and the listeners that have to deal with my Swinglish, but I do my best.
Your Swinglish is perfect.
Thank you.
Men tack så jättemycket.
Till next time.
Till the next time. Okay.
Thank you.
Okay. Bye.
Både och istället för antingen eller, en podd om integrativ medicin och hälsa är skapad och drivs av Svensk förening för integrativ medicin och hälsa, FIM. FIM är ursprungligen en yrkesförening för legitimerad vårdpersonal. Vi representerar sjuksköterskor, dietister, fysioterapeuter, läkare, psykoterapeuter, psykologer, tandläkare för att nämna några. Idag omfattas våra medlemmar även av associerade medlemmar som inte behöver vara legitimerade. Föreningens arbete vilar mot en vetenskaplig grund för integrativ medicin och hälsa, såväl svensk som internationell och på systemisk förståelse för människan i sin miljö. Föreningens arbetssätt har hittills varit att arrangera konferenser, seminarier och folkbilda genom att sprida information, exempelvis via sociala medier. Vår strävan inom integrativ medicin och hälsa är att vara en organisation som vågar lyfta och ifrågasätta, motverka polariseringar genom tvärvetenskapliga dialoger och sokratiska samtalsregler. Vi vill kartlägga forskning som bedrivs, även internationellt, och hålla koll på forskningsresultat om behandlingsmetoder, både vad det gäller den etablerade vården liksom den vård som bedrivs utanför den etablerade vården. Sokratiska samtalsregler innefattas i den sokratiska samtalsformen som egentligen all grundläggande kunskap är sprungen ur, men som ibland till och med lyser med sin frånvaro inom public service. Så bli gärna medlem hos oss, för tillsammans kan vi förändra. Och hur du blir medlem hittar du via vår hemsida integrativ-medicin.se. Vi ses och hörs i nästa avsnitt.